Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you 2 exercises to improve your ability to walk downstairs after surgery more comfortably and more efficiently. So with stepping downstairs or going downstairs, it's an eccentric movement, which means you're going with gravity downward in a controlled manner. It's also a single leg movement, so unilateral. So you're stepping down one leg at a time compared to with a deadlift or a squat, you're using both legs for a bilateral movement. So my favorite exercise is both a unilateral, a lateral step down and a forward step down. So I like to use a therapy step, something like this, an exercise step. If you don't have one of these at home, you can use just the bottom step on your staircase, works pretty well too. And what you're going to do is put one foot on the side of the step. It doesn't matter which one, because I would recommend practicing this on both sides, as there's different stresses and benefits for each side when you do this. And if you have a step at home, you can do it kind of on the longitudinal or the lengthwise part of the step. And this foot is going to be right on the edge, and you're going to have this leg up in the air. And I like to put the foot and the leg a little bit forward, and then all you're going to do is come down and tap your heel and come back up. Tap your heel and come back up. A couple of things to keep in mind is you want to keep your hips and pelvis level, so you don't want it to tilt down like this. And you want to keep your knee relatively straight, traveling with your foot. You don't want it to cave in like this or come out too far either. So nice, good alignment, tap the foot and come back down, come back up. And you'll notice that it's relatively easy with just this one level, lower level step. And if you don't have something that's low enough, you can practice just on the floor, just doing a single leg squat essentially. And then as you get more comfortable, work your way up. Try a higher step if you have it, up to the height of the steps in your staircase, or if you have the stackable blocks to make the step a little higher, you can do that as well. And you just want to focus on good alignment, good control throughout. Don't want to go super quick, just nice and controlled. And you'll notice that you're working on bringing that knee, bending that knee, flexing it in a controlled manner, and then coming back up. And then of course, practice the same thing on the other leg. Then the next thing, to make it more realistic, more like going down the stairs, is do a forward step down. So again, using a step like this, or just the bottom step on your staircase, one foot's going to be right on the front part of the step, the other foot a little out in front, and you're just going to step down and up. Down and up. Another thing to keep in mind is your posture of your trunk. So you want to keep your chest up. Don't want to round your back or curl your back to step down. Try to keep your back up, your chest up, relatively neutral posture of your chest, tap down and up. You can do maybe 10 reps or so and then switch legs and try on the other leg. But all it is trying to get control and comfort with this eccentric motion, this unilateral type of activity. Again, if you don't have a step like this, you can try it on the floor, just as beneficial and just as effective. So I hope you found this helpful. If you are interested in anything related to knee replacement surgery, preparation, recovery, exercises, or rehab, be sure to check out our channel. Be sure to turn on the subscription below. Be sure to leave your comments and questions as I try to get back to everyone I see. Thank you very much for watching.